Thank you so much for that introduction, and I just want to extend my deepest thanks to the AICOG and FOGSI for inviting me out to speak and to be part of this amazing conference at this amazing venue. So I don't have anything to disclose, but the only thing I will disclose is I am not an expert in wellness. I'm still on my own personal journey. And I have had periods of emotional exhaustion, depersonalization, and a low sense of accomplishment at work, which many of you know is the definition of burnout. My objectives today are to understand the rates and the cause of burnout in medicine and obstetrics and gynecology and the wellness initiatives that resulted, to understand the need for us to shift to a culture of wellness and to learn one model to approach well-being, to appreciate the importance of the relationship between individual and organizational resilience, and to recognize the need for social connection, belonging, and community to support all of our well-being. So I put up this picture, and since we don't have our third speaker, I'll tell you the story. I was going to skip this, but this is a picture of my 50th birthday, which was on June 4th, 2021. At the time, I had become Associate Medical Director of our institution, which was over 2,000 physicians, over all of ambulatory care, so primary care, all of the specialty care. And of course, when I took that position in 2019, what hit about 8 months later was a pandemic, which we were kind of making up as we went along. And we had one of the we had the first patients in our state of Oregon, one of the first patients, I think, in the country hospitalized with it at the time. So flash forward to June of 2021, on my birthday, when my husband, I had told him I would go have lunch with him and my family, and I had excuse after excuse why I wasn't going to be able to be there. And as I finally got home late for a lunch, basically finding a friend of mine who'd flown in for my birthday to surprise me later that night, my brother who'd flown across the country from New York to Oregon, to the other coast to surprise me, and into a party later that evening that I well could have missed because of all the excuses I was making as to not show up for the community that had supported me throughout my career. So the party could have looked like the picture on the left, but thankfully, after a lot of prodding, it ended up looking like the party on the right. And what that did for me was it caused me to examine what I was doing with my life at the time. I had been asked to be in that role. It wasn't a role that I had applied for, and it was extremely busy. And was I really filling and giving the meaning to my life that aligned with my values and what I thought my purpose was? So about 6 months later, I transitioned out of that role. I made the active decision to leave. I gave them as much heads up as they wanted. I said, I will stay as long as you need me. And then transitioned back into what really drove me, which was women's health. And I would say my life isn't any simpler, any easier, or any less busy being the president of the American College of Obstetrics and Gynecology, but I'm found much more joy in my life and purpose. So to talk about burnout in medicine and OBGYN, we know that more than half of practicing physicians and trainees are experiencing burnout in the United States at this time. It's at epidemic levels, with hitting a high of 63% in 2021. And in 2023, about almost 49% of physicians reported experiencing at least one symptom of burnout. It has ranged from 40 to 75% of OBGYNs suffer from professional burnout, and in 2023 we found the first little drop from 54% to 51.2% of OBGYNs in the US. But it's really dramatic, because at least you have a high level of experiencing one symptom of burnout in your lifetime. When I was looking up about India, I found, this is just a smattering of articles I found, and it seems that here in this country, you're also experiencing burnout. One study I saw, which was just a questionnaire-based study on medical practitioners, showed 45% and about 66% scored high on the emotional exhaustion depersonalization scales respectively. About 87% scored low on a personal accomplishment scale, and about 63% and 11% respectively had medium and low scores on the satisfaction with their medical practice. So I'm assuming the prevalence is very high, just as it is in my country and other countries. So why do we experience this? So it's a high adrenaline and demanding field. We have poor work hours. We have patients that demand an experience from us, especially in the obstetric world, that does not align with the medical care sometimes that we feel we need to provide. In the US, we have a very litigious environment. We have an electronic medical record that adds minutes upon minutes to every encounter. There are administrative burdens that become more and more for us, especially regulatory in the US. There's lack of autonomy. More than 50% of our physicians are employed, so they don't control their work hours, the time off that they get, their templates of how many patients they see in a day. There's increasing amounts of financial debt, up to $400,000 just for the 4 years of medical school in the United States, and our reimbursement is becoming less and less. It is not keeping up with the inflation of our country, and it has not moved in almost 30 years. And as you've all heard in the news, we're experiencing a lot of legislative interference now in our country with the practice of medicine and what choices we can present to our patients to allow them to make the best choice for themselves. And then we're battling misinformation, especially with social media, on the science and what we can provide to patients. And then when a patient's in your exam room and you're trying to tell them about the correct information and then earn that trust back from a community that's not trusting the clinicians anymore. And then how do you integrate all of that on top of your personal life? When I was reading about India, you have significant staffing shortages. Your ratios to your population have not kept up. Lack of support systems in the healthcare systems, much like the US, of having people and practitioners to help with the mental health needs of our clinician and healthcare population. And there's also a stigma of seeking help. And then violence against physicians and clinicians and doctors here. In a study of the Indian Medical Association that I found, 75% of your physicians have experienced some sort of violence from a patient or their family, or some sort of aggression. And ACOG is working very, very hard to confront these challenges, because it is our mission to support our members so that they can improve the lives of all people seeking obstetric and gynecologic care, and for their families and communities. This is just a list of the things ACOG does to try to support. We try to advocate for better policies, payment reform, clinical guidance, try to combat racism in medicine, strengthening our residency programs and the ease and the burden upon our students, and having a patient-facing website to really battle that misinformation and have a place for patients to go. What this graph shows is with the rise of wellness and the importance of wellness, there were a lot of publications that came out and talked about tools that you could use: art therapy, gratitude exercises, wellness days. There were workshops, webinars, we have them all. They added a core requirement for our residents in training to have wellness built into their curriculums. But we're not seeing like a dramatic drop, despite almost 10 years at least of the rise of these publications. And the reason is because they're giving tools, but they're not giving the infrastructure. We're not creating the infrastructure to support those. We're not providing and figuring out ways to provide more mental health care capacity to our healthcare workers, and resourcing all the initiatives that need to be done. What I like about this slide is it shows what probably many of us have gone through in our lifetimes. And when you look at the era of distress on the left, that's like before 2005. So if you were practicing or in a training program before then, you were probably, expected to be superhuman. You didn't need sleep, you didn't need to eat. You stayed till the work was done, 36 hours. There was no work hour restrictions. It wasn't a time where when you signed out your patients, you did it all. And it was a sign of weakness if you couldn't do it all. When you shift to the middle to Wellbeing 1.0, that's 2005 to about 2017, 18, there was a recognition that we should have some work-life balance. It's important to be healthy, it's important to sleep, it's important to exercise. So we're talking about the tools, but we're not given the infrastructure to implement. And now, after 2020, we're in that time where we're talking about it, and how do we have the organizations support us in that? How do we recognize this the toll it's taking on our workforce. How do we support people and provide them resources? So one model I wanted to show you, there are many models out there, but is Stanford's model of professional fulfillment. And it's an approach to well-being that's not just about reducing burnout, but shifting a focus toward improving resiliency, and both for the individual and the organization. And because if you are finding joy in what you're doing, because every job in healthcare is challenging and difficult, then we are going to increase professional fulfillment and decrease burnout. And if these interventions are based and the organization supports it, it's going to be more effective. And I talked about having employed physicians, and which is why it's so important that the organizations support. But you also need physicians' engagement, and you need them to inform what initiatives are actually going to help. So here's the model. There are 3 domains, and the domains, it depends on all of these having relationships to each other. They share a common mission. They affect both the individual and the organization. But if we're able to drive this, people will feel valued and empowered and engaged. They'll feel part of an effective team. They'll feel like they belong. They'll feel part of community. And they'll have purpose, and they'll feel like they're making a contribution to something meaningful, which is larger than just them. It will affect how we collaborate and communicate. It'll affect how we our work and how efficient we are in the workplace. And we know that that leads to improved performance, better patient experience, better quality, and decreased costs in healthcare. So the first one is efficiency of practice, which is workplace systems, processes, and practices that promote safety, quality, effectiveness, and positive patient and colleague interactions and work-life balance. And we've seen this list already in my presentation. So how do we make that successful? Well, we involve the workforce in designing the workflows, the processes, how we do our work to make us more efficient. We have people inform what are the right staffing ratios we need. We build staffing to recognize that people need time off, that they're going to take medical leaves. And so it has to be informed. The second is building a culture of wellness. So an organizational work environment that values behaviors that promote self-care, personal, professional growth, and compassion that physicians and scientists have for themselves, their colleagues, their patients, and beneficiaries of their innovations. So this is where you need leadership commitment. You need them to commit, you need to have them drive this, prioritize it, and resource it, and measure that the tools they're implementing are making a difference. You can have a wellness champion, but I would say if you have a wellness champion at your institution, they should sit on an executive team so that they're with the operational team and driving wellness throughout from the top down so that there is buy-in. You need to have a burnout tool. There's several of them out there to measure the effectiveness again. You need to build in social events and celebrate people's accomplishments and recognize them. Build in time for retreats. Have mentorship and coaching opportunities. And something we are doing at ACOG is we are starting to build peer support systems, because not everybody's institution has the resources to do peer support. So at some point at ACOG, we will have a place where if you're an ACOG member, you can pick up the phone and you will be matched, it might be across the country, with a peer supporter that can help you. But what is most important is that we normalize that struggling is okay. We ask about it, we recognize it, and when we see it, we assist our colleagues in getting the care they need. And that we show people, and we can lead by example, that it is okay to be vulnerable, it is okay to be struggling, and we can get better. And then the last one is personal resilience, which resilience sometimes can be a dirty word, but this is about our individual skills, behaviors, and attitudes that contribute to physical, emotional, and professional well-being. So this is where you build in things at work, helping get people, those are where you have workout restrictions, right, to give people the time off they need. There's a hotline to call if you need help. There's peer support built in. We had something called a navigator at my work, where if you needed childcare and you didn't have time to interview a bunch of nannies, you could call this service and they would provide it and help you find a nanny for your childcare so you could be at work and know that your kids are secure and sound. Lastly, I want to revisit COVID for a second. So we went through something very, very challenging, right? I mean, something that none of us had ever been through before. However, it created an instant community around us to get through that difficulty. And that resilience activation happened because there was something called liminal suspension, where people just suspended what they did to all work against a threat together. So primary care and specialty care, I saw, they were willing to share patients, see each other's patients. Orthopedic doctors were willing to see any sort of back pain, so primary care could take care of all the patients with respiratory problems. We had our people, our community banging pots and pans for us and forgiving our backlogs and the care we couldn't give them, the preventative care. And then we had health systems in my city that usually compete, working together to provide beds for each other, ventilators, right? But then as the numbers came down, all of that went away and our community went away. And now I find that patients are even more anxious and sometimes upset. So just quickly, if we have a little more time, if I can, okay. I wouldn't have told my story. Wanted to show you kind of what are the 4 things that are very important in it between an individual and their organization that we have to do, and things that we can do ourselves without resource that is going to help people with their professional fulfillment and resiliency. And that is communication. Make sure that you're having great two-way communication with people at your organization. Make them understand the why, because we're all going to have to do difficult things. But if they understand and they feel that psychological safety that they can ask questions, they will feel like they belong and they're part of it. Create that sense of belonging for people. Create that community. Share the vision so everybody understands and are rowing in the same direction when we are having to drive work. And then recognize people for the gifts and the talents they have. Everybody should do something in leadership, I believe. Everyone should help. And everybody has different talents. Some people are more organized. Some people are more visionary leaders. Give them the job that their talents will help them be successful in. And they will have more meaning and feel more tied and affinity for an organization. Because by doing all of this, you will gain more than all the gratitude exercises or wellness days off that you can give, yoga, all of that. Those are still important. I'm not trying to say they're not. But when you positively influence all those areas of connection, you're going to improve relationships and create attachment both to people's work and their organizations. And then if that's negatively affected, then you'll have a decreased sense of attachment, and that contributes to burnout. And this is something our whole community can do for each other, because we want to feel connected. We want to have purpose to what we do, and that's our basic human desire, is to feel useful and that we're making a difference. And if we feel like we're making a difference, we will feel joyful and content each day. One thing I want to mention is purpose changes with changing opportunities and circumstances. It's not a destination, it's not a job or a goal, it's a whole journey. And so you want to make sure that you're working towards your goals and they're aligning with your purpose, and that will help pave your path to wellness. And that is what I discovered in June of 2021. And then it will help you believe that our lives and what parts we're playing is mattering. So again, social isolation, I'll just say, I won't read through this slide, all the negative effects, but connection has positive psychosocial benefits, physiological benefits, and behavioral benefits. And just connect with people. It can be family, friends, work friends, it can be on the phone, virtually, in person. Just cultivate those high quality connections, and that's the key to leading a joyful and fulfilling life. And these are all the things you can do in the next week that are very, very easy to do to help create and enhance that sense of belonging and connection and to strengthen your community. Here are some pictures of my community. Down at the bottom is the ACOG board. At the top are my work friends that I made do karaoke to help us feel safe with each other. And then my big family on both sides, our last holiday. So we need to come out of our silos after the pandemic. We have to confront our challenges together share knowledge, solutions, and our coping strategies to build our resilience. And that's how we will keep our workforce healthy, how we will be able to take care of the population together. Thank you so much.
Hi, Stella. Hello, Stella. हमारा म्यूट किया है क्या?
Hi. How are you?
So good to see you.
Good to see you.
Yeah. See, it was a lovely talk. It was really wonderful. And I think physician burnout is so, so important. And so is the patient burnout also. I think you highlighted it so well in COVID and non-COVID. Uh, I think in India, we have very long hours, so there is no limited practice. We are on call
Right.
24/7. So I think it has a lot of psychological impact also. So yes, I think what we have done is we have started doing group practices so that we can help each other, be a community, and work for each other. It is really good. What are the different things that you all do in America?
So we have group practices here. We are, we have large multi-specialty groups so that we can make sure that we have time away. I think it's interesting because when I trained, it's a long time ago in Hawaii, they were much like it sounds like in India, where they were solo practitioners, and even if they formed a group, they really weren't a group that covered for each other. Even when they were on the island, if they had a delivery, they went in for that delivery. And and then now they've started to cover each other's patients. And I know it's a hard transition to make, but in my practice, when you are off, you are off. I mean, if you want to sign out your in basket so that when you're gone, you can actually detach from your electronic medical record and covering all those, your in basket and all those questions that come in, because it's shown that you have to really be off of your electronics for a certain amount of time to really start to relax. You can do that. The other thing, and that is hugely important though, when you have an organization, and I don't know that we're there yet, in this country, is you need to build and have the workforce that covers for that so that when people are gone, it is not just falling on a smaller number necessarily of people, that you're actually looking at when you think about all the days that need to be covered, you include the days that you also want people to be away, if that makes sense. So you actually have to figure out staffing for that. You either have to bring in locums to cover for that time so that it's not burning out the people that are left behind. In my organization, we have people who are, they're at retirement age, but they're not really ready to stop forever, but they just want to scale down. They're the perfect people to do that because they have flexibility in their schedule. Often they're enjoying life and they're happy to make a little extra money to come and cover for a week. So, and it's kept them involved. It's given them purpose, but allowed them to ramp down their practices and as they ease into a full retirement.
I think Stella, good of you to come for the program. At present 3,700 people are registered and 1,900 are online seeing the program. So, when I came for the ECOG meeting, this was one of your themes of your presidency, and I was really impressed because we have occasional, in fact, some suicides also amongst the resident doctors, and it's a real big problem we are facing, and we have to see that we prevent this from occurring because the work load is quite a lot, plus they are on a lot of pressures, and they are not expecting such kind of sudden onslaught of work. They are from their academic activities, suddenly they are suddenly dropped into massive amount of work, and there are a lot of emotional factors that are also playing interplaying at the same point. And I feel this is very important for FIGO to take it as an important thing, because I had noted it at that point in time that this is a very important topic for FIGO to look at, because this must be happening all over the world, because our especially gynec residents are under a lot of pressure because deliveries take place 24/7. And I think it's a very important topic, and that's why it has a lot of relevance worldwide. You want to say anything more, Nandita? So thanks a lot and we
Yeah.
would like to looking forward to meeting all of you from the United States in Cape Town already. Just now, Priya
Yeah.
Soma Pilla had come in the evening to give a talk, and that time she told us that 5,000 people are already registered
Wow.
for the Cape Town meeting, and nearly three. I think 200 is little less number. I'm sure it is more. 500-600 must be from India. So, but
Yeah.
we are also looking forward to meeting you all there and interacting with you. Thank you for coming. And
Thank you so much for the opportunity. It's good to see you.
good to see you. Thank you. Bye. Bye.
Bye.
Bye.